from the MDHHS side of things. So first of all, I want to bring to your attention our 2024 schedule for our Mother Infant Health and Equity Collaborative, or MIHEC, which is much easier to say. Our MIHEC meetings, all of these meetings are virtual. They are free to attend, and they're scheduled from 1 p.m. to 3 p.m. However, to attend, you do need to register so that you receive the Zoom link. It's just a little extra security measure so we don't get spammed during our meeting. So I will share these slides with Elena, and she can share them with all of you because all of these different meeting dates are linked right to the registration link, so you can sign up for all of them. There should be a way that you receive the Zoom link. As soon as you register, there should be something that pops up that sends you a message, and you'll have the Zoom link so you can add it to your calendar. We don't have a way to send you an actual calendar invite, but you can create your own, and you can, so you have that information readily available for you. So our next MIHEC meeting is February 15th. Also want to draw your attention to the fact that our Maternal Infant Health Summit for 2024 will be June 17th and 18th. It will be in person again, and it will also again be at the Lansing Center. So we kind of got locked into the Lansing Center due to some COVID constraints we had to with our I'm losing words today for some reason. It feels like a Monday. With our contract. So the following year, 2025, we'll be looking for to move elsewhere in the state. However, we are somewhat limited on the places we can go because we are now raising the number of attendees, our cap, up to 700 individuals. So there's only a certain number of places in the state that can hold that many people. So but nonetheless, this year, 2024 will be at the Lansing Center again. There'll be more information coming out in regards to the agenda and registration and things like that, but just to put that on your calendar. However, there has been a call for proposals or presentations that has been released. This is now open, and you can submit presentations or proposals until midnight on January 7th. So you have a few more weeks left if you'd like to submit a proposal for to give a presentation during one of the breakout sessions. You'll be notified by February 9th if your proposal has been accepted or not. So you won't be left hanging. You'll be notified either way. The theme for this year's summit is Advancing Healthy Births from Stories to Action. I believe in the proposal, they're asking that you gear your presentation to be in line with the theme. So just a heads up on that if you're thinking about submitting a proposal. And in order to actually submit the proposal or for additional information, you can visit the Maternal Infant Health Summit webpage, which I have linked here on the screen. And I'm pretty sure we talked about this last time, but just in case there are new folks joining us today, the Division of Maternal Infant Health released a strategic plan or a birth equity plan back in October. This is a new iteration. It's been named Advancing Healthy Births and Equity Plan for Michigan Families and Communities. It has a lot of great information in it, and you can access this document on our webpage, and I've linked you right to the document here as well. And this is just, these next couple things are just something that I thought would be beneficial for folks to be aware of, might be interesting. I was recently made aware of a special issue of the Maternal and Child Health Journal. It's the December 2023 journal. This special issue has 21 articles that are dedicated or focused on public health approaches to perinatal substance use. So I wanted to just bring that forward to everyone in case you are interested in reading any of the articles. You can access the issue on the link here on the slide. There's also a toolkit. I don't know if that's helpful at all or not. I just wanted to include it as it was made available in the press release. So in case that is of interest to you. And then also, I don't think I mentioned this last time, but the rates or the numbers, cases of congenital syphilis have increased and are continuing to increase in the state of Michigan as well as nationwide. Actually nearly half of actually, no, hold on, sorry. So there's been several missed opportunities and inadequate treatment of pregnant people. And this continues to result in vertical transmission of syphilis. So the pregnant individual passing syphilis to their infant. And so some potential outcomes, like, so why are we concerned about syphilis? So some potential outcomes of syphilis infection during pregnancy can include stillbirth, miscarriage, infant death, and maternal and infant morbidity. This is, I think this statistic has been updated since I made this slide, but congenital syphilis cases in Michigan have increased 320% since 2017. There was also some data that said that nearly half of Michigan babies reported with congenital syphilis in 2023 were born to individuals that had little or no prenatal care. So again, kind of showing us the importance of prenatal care and the importance of testing pregnant people. I believe the testing guidelines are linked here on the screen as well. And I believe it's first and third trimester. And then obviously if there's identified risk, and test again in the pregnancy. But first and third trimester, I believe, is now what the public health code says for all pregnant individuals. So there were 37 reported cases of congenital syphilis in Michigan in 2022. That's a lot of cases of congenital syphilis. So something, especially if you are in a clinical setting, something to keep in mind. Please make sure if you're in a clinician office or in a birthing hospital that you are taking a look at these testing and reporting guidelines. There's a screening flow chart here as well as additional information about congenital syphilis. You can look up county level syphilis rates. So just some information that is important and something to be aware of. And then finally, these all get sent out to you, I believe so, but if you want to receive them into your inbox directly, you can sign up to receive our maternal infant health update emails. The link to sign up is here on the slide, and so when you receive them, you should just be able to click that link and you can sign up. Otherwise, that is all that I have for today. Does anyone have any questions? All right. I will hand it back over to you, Elena.
Thanks. So that was a great segue talking about all of the things that MDHH sends out and that they get sent out to you. SWMPIC has made some updates and we have some things we'd love to share with you. So Andrea, go ahead and take it away.
Okay, hello. So there have been some updates to the SWMPIC. I'm sorry, to the swimsuit. I'm gonna be all tongue-tied this morning. The SWMPIC website. If you've not yet checked out the SWMPIC website, take a few minutes and look around. If you have any resources or you'd like to share on our website or on our social media, there's a link under the Events Update tab. And you may have received MDHHS or other updates from Elena or Jessica in the past. SWMPIC is trying out something different. We are now sending out an email on Fridays with the latest class info, regional events, and links to the MDHHS updates directly from our website. If you have not seen these in your inbox yet, you're either not in the contact list or they're ending up in your junk mail or spam folders. To ensure that you will receive these emails, we please ask you to subscribe.
So we're gonna pause there, and Elise is actually gonna show you on her screen, so I'll stop sharing, how you do subscribe to the emails to make sure that you get all of the updates from SWMPIC and from MDHS moving forward.
All right, thank you. Let me see if I can do this right. Share my screen. Oops. Hold on, bear with me. Can you see my screen?
There's
Can you-
normally a delay. We'll give it just a minute,
Okay.
but no.
No, nothing. Great. Okay, hold on one second. Okay, here we go. I think it's working now.
Yep.
Okay.
It says you are, yep. Okay, there we go.
Okay, perfect. So this is the SWMPIC website. When you go to the homepage, this lovely little box is going to show up. This is our subscribe box. So feel free to just put your email in there. If you don't want to subscribe to us, that's fine. Just click the X and it will go away. If you get to this point and you've clicked the X, but you're like, oh man, I've changed my mind, I do want to subscribe, you can scroll all the way down to the bottom of the website and subscribe down here also. So I just wanted to kind of walk through the website also just to show you around quickly. Obviously, this is our homepage, shows who we are, why we're doing the work we're doing. There's some information here about perinatal mental health, vaccinations, safe sleep information. This tab is our free classes. You can go here and actually register for classes. There's some information about our educators on there. And then this is the events tab. So if you click on it, this will show upcoming SWMPIC specific events. So information about our quarterly collaborative meetings and a button to register for them, as well as some regional events. The easiest way to figure out what's happening in the region specifically is if you just follow our Facebook page. We reshare a lot of content on there. And then these are also the MDHHS updates that Emily was talking about also. We'll share them here on our page too. Lastly, this resource tab, we're working on this. It's a work in progress. I know this doesn't work really great on mobile phones, but right now it's just an Excel sheet, just a whole bunch of resources and information about the birthing hospitals in our region. And then we also have a tab for providers also. So please subscribe.
Awesome. Thank you, Elise. So yeah, we can give you some time here to subscribe. If you get a chance during the meeting, we have a couple of places where we pause. All right, Andrea.
Okay. And then getting back to the information we were sharing, the grant that supported the Reducing Your Risk Perinatal Mental Health class ends at the end of this calendar year. So these classes have been concluded, but SWMPIC knows how important mental health is for birthing persons. So we're looking at a partnership with PSI to bring the content to anyone in Region 8 and still provide the opportunity for incentives. Okay, SWMPIC is also very excited to announce that this fiscal year, which runs from October 1st to September 30th, 2024, we received an increase in the ongoing funding that we received from MDHHS. As you may remember from the August and September quarterly collaborative meetings, SWMPIC just completed strategic planning and have spent a lot of time considering how to make a big impact to moms and babies in Region 8. With this increase, and ongoing funding for SWMPIC, will be hosting listening sessions with birthing persons, having an in-person town hall event, interviewing local health departments, and diving deep into maternal and infant health and community needs assessment reports. We want to make sure that we understand the needs of the community and are focusing on the challenges that moms and babies face. We will also be working with The Haven, a recovery center that helps pregnant and postpartum women. Through the quality improvement, SWMPIC plans to explore how to establish screening and a referral process at local health services to support perinatal women with substance abuse to get treatment. If this is an area of interest for you and you would like to participate in this work group, please send Dr. Karen Garcia or Elena a message in the chat. SWMPIC knows how important the connections to others working on maternal and infant health can be, so we will be concentrating on building and strengthening connections with others in the region. We ready for next slide? Okay. The next Birth and Beyond class will start January 4th. The class will be every Thursday for 6 weeks from 6 p.m. to 8 p.m. Depending on how many sessions participants are able to attend, they can receive a new car seat, pack and play, or a box of diapers and wipes. Registration is currently open. Please feel free to share this flyer with anyone who could benefit from this class. Any pregnant persons living in Berrien, Cass, St. Joseph, Branch, Calhoun, Kalamazoo, or Van Buren counties are eligible to participate.
Awesome. Thank you for those updates, Andrea. Does anybody have any questions on any of the things that were shared that SWMPIC is working on right now? Okay. Well, we're
Elena,
super. Yeah.
I just want to make a quick week 6, just on the poster, it says infant care, but it's actually infant feeding. So there is the component of feeding in the class.
Awesome. Thank you. We'll
And that's
make that
hosted by
update.
me usually.
Yes.
So,
Yes. Dr. Garcia, lactation consultant, handles that class. We have instructors who have different like niche areas who hop in on this, but it's the same cohort of participants who go through all 6 weeks. So they get to know one another, and it's a really awesome, safe space where questions can be answered, and it's a really awesome opportunity. And you get really great things if you go through it. So like they said, the car seat, pack and play, diapers, wipes, depending on what your needs are. So yes, we would love for anybody who is wanting to participate to go ahead and register, or if you know of somebody, please share that.
and I'll just throw in that the camaraderie that the families that go through all 6 classes together end up developing is so fun. Since I tend to be the last person, it's really amazing to see them introduce each other and give information about each other. And at the end of our class last night, actually, they were all cheering the next person whose due date is this weekend. They were all just telling her how excited they were. And so it was really incredible and really amazing to see the camaraderie that develops with them as well.
That's so awesome. That's what we want, right? Cool. Well, it's a really awesome class. Like Andrea said as well, if perinatal substance use is an area of interest for you, let Dr. Garcia or myself know. All right, I'm going to pass it on now. We're going to move our way into our activity. Sarah.
Yeah, and actually before we move on, I'm just going to put in a personal plug that my oldest just turned 19 2 weeks ago, and we are still good friends with 2 of the families that we met in childbirth class. So like that's just such a unique time in your life that you're like all vulnerable and in such a new space that really is, those bonds are serious, lifelong. So and the kids aren't even friends anymore, you know, like they've moved on to their own things, but the grown-ups still are. So anyway. Well, now is an opportunity for us to take a few minutes to hear from you. And so we're so glad to see all of you here from such a wide variety of organizations and parents and community members and across several counties. So we really want to take some time for you to chime in on just share some of your great ideas and your, amazing thoughts. So just to think for a minute before we go into some small groups, the 2 questions that we'll be asking of you is very dreamy, right? So just give yourself some chance to just like, don't even do the yeah, but just dream and just dream big. So for those of us that are representing agencies like myself, I'm from Kalamazoo RESA. The question is, what would you do with $50,000 to improve maternal and infant health outcomes? So big dreams. And then for those of you that are here as community members, family members, we want to know where do you see gaps in services that $50,000 could improve? And maybe you don't have a $50,000 idea. We still want to hear the $10,000 idea, and we want to hear the $1 million idea. We want to hear it all. Sherry is wondering if we can share the number of participants from each county. I don't know if you mean during this meeting, like who do we have here in the room? But maybe when people are in small groups, we can do some of that and then kind of come back and do a little tallying. But I think, Elena, that you're dividing everybody up right now. And so we're going to have some facilitators there, but it really is an open conversation. So you're going to get put into a small group. We're going to have about 10 minutes to just have some conversations, very brief introductions, and just start to brainstorm. So if you're like, I can't think of anything right now, when somebody else says something, you might think of something. So just start to think about, sometimes it's those things you wish you'd had access to, or clients or families you've worked with, you wish you'd been able to provide for them, like at the drop of a hat. So, that's okay if you don't have a big idea right now. Once you get in your conversation rooms, your breakout rooms, you'll have an opportunity for those conversations. So without further ado, Elena, are you ready to send us?
So change of plans.
Okay.
We want to make sure that the community members are able to all come together in a room to talk about this other question about like what gaps in services. So we're actually going to open up breakout rooms and let you pick which room you're going to go into. So that first room is going to be with the first room, right, Jen?
Yep.
It's going to be with Elise, and she is a community member herself and part of SWMPIC leadership. So she's going to do that group. And then there's some other SWMPIC steering committee members who are going to lead the other groups. So aim for like 10-ish per group. So you get to pick which one you want to go to. And if you need help, Jen can help you get into a room.
Yes. And since the facilitators will also have to pick which room you're going into, I put your names as the name of the room. So when you click on that thing for the breakout rooms, you'll see your name there. So you can just pop in there, and that is the room that you'll be facilitating in. But let me know if you have any questions or any issues. All right, I'm going to open them up right now.
Sorry, I think that's me. I was busy typing over here. So I do want to invite out, I know our conversation was super rich and we could have kept going for another at least 10 or 20 minutes, but I'd love to hear a couple of highlights from some of the groups. We won't take a ton of time on this because I know we have notes from each of our groups, but particularly the community member group, I'd love to hear what were some, maybe two of your amazing ideas.
Yeah, so I can share out for our group. And I don't know if we were supposed to put this in the Miro board, so I'm sorry. I'll just tell you. Okay, so we talked about support is needed for older children, specifically mental health support, and mental health support that is actually affordable and that you can get in easily. And then also mental health support for moms. So we had talked about it in this group before of, when baby's born, baby has a lot of well child visits and you're constantly at the doctor. Taking that opportunity and actually checking in with mom and, maybe creating some space to check in that way. We also talked about the need for car seat techs to make sure that kids are safe in the cars. And then also figuring out how to actually get resources into the hands of families. So it seems like the resources are there, but how do we actually have the trickle down effect so that families know about them? That's it.
Awesome. Thanks, Elise. I'm sure that was a great conversation. Any of the other groups have one or two highlights you want to share?
I can share from our group. So we talked a lot about providing services and supports around like health education and prevention for individuals who want to become pregnant. And so actually like backing up where the education is provided. And so thinking more along the lines of prior to pregnancy, there was some ideas that were flown around about like perhaps like some sort of class or some other modality or method of getting to those people who are thinking about becoming pregnant and really sharing the like, this is what the process looks like once you become pregnant, and really sharing about like why it is you go to prenatal care and why you do these certain things, so that there's just more of an understanding. We also talked a lot about the like one-on-one relationship building and connection. So thinking around doula peer supports and just community health based places where we can talk about really building that relationship and having that be something like a support for a pregnant person throughout their time.
I can share a little bit from my group as well, if that's okay. So we had some representation from our NICU, and one of the big things that was discussed about was having a discharge coordinator, educator to really help support our families before they leave the hospital, and trying to coordinate them with all of the support that they need, and also more representation within lactation services within the NICU themselves. We ended up kind of bundling things a little bit, but one of the things that came up was potential care packages for individual needs for people. So for instance, Marcy brought up how there was a woman with hypertension and she didn't have a home blood pressuring monitor kit. And so how do we connect people to those individual resources to help support them either through pregnancy, through delivery, and even into that postpartum period? And the thought was thrown out that how do we potentially bundle that with a life coach to help people with those big life changes that includes raising children and bringing children into the home. We also talked about perinatal resources and education for physicians surrounding substance use and misuse, and specifically targeting the stigma around it to really help support the medical community and being able to reach those individuals. There was the idea of a facility, kind of like the ones that they have in South Korea, where a mom is able to come, insurance pays for it for a week in-house with her babies, and they go through education, nursing support, exercise, nutrition support in that first week postpartum to really help them as they transition to home. And then we also spoke about the importance of in-home lactation care and how quick lactation care is so imperative and important, and supporting mothers' bodies getting stronger after delivery with nutrition exercise consultants and pelvic floor rehab, and how we can potentially have public information messaging on the importance of prenatal care.
I love all of that. I'm going to go next because I'm going to kind of piggyback on some of the stuff that you said as well as Elena. So our group talked about how awesome it would be to have a hospital-based doula program, and how that would be helpful because it's a bridge into the community to help build confidence and trust within the healthcare system. Also, because we have such a big rural area too in our region, to be able to have doulas from that area that are able to come and not only take care of them while they're birthing, but to have prenatal visits as well as expanded postpartum care visits. We also talked about potentially getting doulas trained. We talked about expanded home visiting programs postpartum, also making sure to kind of like what you were talking about with personal care, toiletries and items that they need in the postpartum, as well as things like even diapers or transportation, having those basic needs met. That's what we discussed in our group.
In our group, one of the things specific to breastfeeding was the hope that medical providers and anyone who's going to have a touch point with the family between when they leave the hospital and maybe that first WIC visit is just more trained in breastfeeding support, as opposed to just going quick to formula when there's maybe a slight concern. So just a more well-rounded medical background on breastfeeding support. Ideally, like everyone would be certified, right? But more knowledge. We talked a lot about the need for some communities just to have access to OBs. We have, families that, prior generations would have been able to birth there in their community. They no longer can, but even still, they have to drive very far for their OB care, which I think then Sherry added a note about, this is leading to inadequate prenatal care. People just can't make it. They can't take that time off. They can't always make it into where they need to make it and have access to that prenatal care. A couple of people talked about just that post-delivery window, like that really right after delivery. So wouldn't it be wonderful to have people coming to people's homes so that you don't have to lug a a heavy carrier out into the cold and get your baby cold and potentially put yourself at risk. So we've got moms that really shouldn't be doing a lot right away. They should be just resting and connecting with their children. So having that to me sounds so dreamy, but I also know so many other communities that are doing it, that they're having like a nurse or a midwife or someone who's coming, checking baby, checking mom, and just offering that as opposed to like 48 hours later, like bundling up and going out into the cold. Listen, I had winter babies, so that was always why like driving them in the snow was terrifying. So just we know that has really significant outcomes in the communities that are able to do that elsewhere. So I think those are some of the main. Oh, and then that like those face-to-face prenatal classes. And including that post-delivery window so that it's offering baby yoga, it's offering some exercises, Dr. Garcia was saying, offering that support for breastfeeding and that kind of peer-to-peer interaction and support connection. So I think I covered all the big ones. Were there any other groups that did not share? Sounds like we all kind of took notes in different ways. We just ended up throwing ours into a Google Doc because I also wasn't like able to find on the Miro board where I was supposed to add stuff. So hopefully somebody in your group captured notes and you have those, and we will make sure that we get those relayed into some sort of document that makes sense. But for now, I'm just really grateful that all of you were able to kind of put on your thinking caps. I know that not everybody maybe got to share, but hopefully you can at least share with your facilitator some of your thoughts and we can make sure they get captured. And I hand it over to Elena.
Yep, I am up. Sorry about the mirror board, folks. I'll get your notes from you. Okay, so I am gonna share again my screen. You're probably wondering, that was a really fun exercise, but why are you asking me to dream so big, right? And that's because we have some really exciting news to share with you. So, can you see my screen? Cool. Okay. So we have very exciting news that SWMPQIC will be awarding 7 mini grants in the amount of $50,000 to support community-led efforts in improving birth outcomes for anyone who lives in Region 8. So we are so excited that this is something that we're able to do. The money for these grants is trickle down. It is coming from MDHHS, but they realize that there is some barriers in having the statewide necessarily the funding come through there. So by allowing SWMPQIC to award these grants, there's a couple wins hopefully that we are able to do. So one, we know you all and we have you here and you're able to tell us some of the things that are important to you and some of the amazing things that you all are doing in your communities. So we would love to be able to leverage those things and see what $50,000 could do for that, right? Another reason or another pro to having SWMPQIC oversee these mini grants is so that hopefully they're an easier way for you all to apply to them, right? So I'll go over in a little bit some of the like eligibility requirements and some of the things we're asking of you. But the idea is not for this to be like, you need a grant writer and it needs to be something really elaborate. Like we really just want to hear the amazing ideas and the work that you guys are doing and try our best to get funds to the people who are going to make a really big impact. So like we said, it's community-led efforts. So when we're talking about Region 8, we're talking specifically about Southwest Michigan. So Berrien, Cass, St. Joe, Branch, Calhoun, Kalamazoo, and Van Buren counties. And so if you serve those areas, this grant could potentially be for you. So let's talk about some of the eligibility. So if you are going to apply to this grant, some of the things that we will be checking is just if you serve people who are living or working in Region 8. So again, those same counties, we're talking Southwest Michigan. If you serve Berrien, but you don't serve any of the others, that's okay. If you serve Berrien and our friends to the north who are not in Region 8, that's okay because you are serving those who are in the region. If you serve the whole region, great, even better, but it's anybody who is living or working in Region 8. To apply, you have to be a nonprofit, a local tribal organization, a community-based organization, or a local county level agency. So not an individual unless you are a nonprofit or one of these other things that are listed here. But we, again, tried to keep this pretty open so that it applies to most. If you are awarded, one of the eligibility requirements is that you can say, I will have all of the money be spent by September 30th of 2024. So this grant fund period will go, we'll talk through timeline too, but it'll go through March 1st through September 30th. Another thing that we are looking for, so members or agencies who are going to come together and we're going to look through all of these proposals. If you want to be a part of that decision-making process, if you're interested, you can let me know and we'll put together the steering committee will put together a review. But if you are going to help decide who gets the money, you can't apply for the money, right? Conflict of interest there. So anybody who is reviewing the proposals will not be able to get the funding. Questions around eligibility? Okay. I'll pause for questions many times. So if one comes up, oh, Sherry.
So our intermediate school district has a home visiting program, and I think some others do too. So could a school district, which is a governmental entity, apply or not?
Yes, I believe so.
Okay, thanks.
Awesome. Okay. So we're going to talk a little bit more now, excuse me, about the timeline of this grant. So it is relatively quick, speedy, all the things. So the timeline for this, so today is our information session. We're going to share out all of the things about the grant, answer any questions that you may have. We are recording currently, so we can put this on our website. So if you leave this meeting today and you say, oh my gosh, so-and-so should have definitely, heard about this grant, they will be able to come to our website in a little bit and be able to review this recording. And so they can get that info too. We will release all of the documents, so the templates, the proposal application, all of the things that you have to complete will go out on January 1st, but it is all going to be just the template of the things we're talking about today. So there won't be necessarily any surprises or any shockers there. So if you wanted to start thinking about putting some things together prior to the 1st, you can absolutely do that. We ask that, again, short turnaround, but that all proposals will be submitted. So that's just by email to me on January 15th. And then our review committee will get together and we will make the decision on who those 7 mini grants will go out to. And those will be awarded February 1st. So you will know really quick whether or not you are one of those selected. And then contracting and those things will go into place and funds should start, the grant period should start on March 1st. one of the criteria or the asks that we have of you. So it's to work towards improving disparate health outcomes. It is making sure you're spending all of the money in a fiscally responsible way, and that you are meeting with us midway through the grant period, so somewhere around June, to just tell us how it's going, talk through some of the things that you're seeing. What are some successes? How is spending the money going? Are there areas or challenges you want to talk through with us? Some of those things. So a 30-minute check-in, and then the grant period will end later on September 30th. Again, so the midpoint is a check-in. It's just kind of a verbal one with us, but then we are going to need a report. Not anything scary, but just being able to show these are the things that you said you wanted to do. How did it go? So that will be due October 15th, and the funds will then, they'll be done. Questions on timeline? It is fast. It is one time. So this is not something that gets to continue, unfortunately, but we're very excited to be able to do this. Okay. So the Advancing Healthy Births RFP, or request for proposal, this is the components that we are going to ask for you all to share, and then what we are going to use as a committee to decide who gets those 7 mini grants. So the first part that you are going to include is just like the contact information, the things that are helpful for us to be able to know who to reach out to and who to contact. So organization name, address, the contact person, what you would call your project. We would need the IRS W-9 form. We also would need the things to prove, some of the other documents that are formal, but should be relatively easy to have. And then a project narrative. So again, you shouldn't need a grant writer. It's only 2 pages, right? Like, we want to get the info from you, but please don't write a book. Like, we want to understand what you're doing, but don't want this to be a massive barrier for any organization. So the things that we would like to know inside of that narrative is the population that you are serving, and why they are an area of interest to your organizations or those counties that were affected. So I know that when we broke out into breakout groups, we had somebody who popped in and said that they do peer-to-peer breastfeeding, and they do doulas, and they work specifically with migrant population. So like, those are the type of things that you would want to pull out and highlight. Also talking about what counties that you are serving, where are those populations within Region 8. Describe what will occur if awarded the grant. So what would you do with $50,000 to improve maternal infant health outcomes, right? So really kind of putting together a narrative of the plan that you would do to improve those outcomes. Describe how the project will address disparate outcomes and improve healthy births. So again, just describing some of that data that we went over in our previous quarterly collaborative meetings. How would you see that data improved if you were awarded? Any barriers or challenges you could potentially face, goals or expected outcomes if the project is successful, and how would you know if it's successful? Some of those measures. And then share resources or processes that you already have in place. So do you already have the staff to do these things? Is this an existing program? Would this be something new? So just a little bit more of that infrastructure piece to it. And then also would be included a budget. So how would you spend that $50,000? And we will provide a template for you. You just have to fill in your info. Okay. Pausing again for questions.
So Sherry had put in the chat, is there a plan
Thanks.
Is there a plan for there to be one grant per county, or can a larger county have more than one organization apply?
Great question. So we are keeping in mind that we would like to serve the entire region, but that doesn't mean if somebody applies for Berrien County or Kalamazoo County that that's the only one that's going to be there. We're going to look at it as like a overall comprehensive, what are people doing in their narrative, like what's the plan, but we ultimately would like to serve the entire region if we can. Any other questions? Thanks for pulling the chat. Okay.
There's another question. With the short
Perfect.
time, the number of actual births in that time is limited. Do you have any other suggested measures?
Yeah, so I think it depends on what specifically your grant is going to do. So I don't think you need to necessarily look at like outcome measures of healthy births per se, but if it's like, if you're looking at expanding, I'm just going to say like the peer-to-peer doula program, it might be like how many people were connected to a doula, or how many times somebody was able to see a doula. Was that expanded based on this $50,000? Were there now postpartum visits versus only prenatal and birth before? Like, so I think you could look at some other measures, some more process-like measures. Birth outcomes is great as well, and we love to see those, but yes, it's a short time frame, and those are harder to measure in a shorter amount of time. If you have questions as you're in the proposal as well, you can definitely reach out to me and we can talk through some of those things too. Janine.
Yes, thank you. Will this be just a one-time grant, or will this be renewed at all?
Great question. This is a one-time grant. The funding is coming from MDHHS. They were able to secure this lump of funding. Actually, every region in the state is getting some funds based off of their birth and their birth outcomes. And so Region 8 was given this amount, and we are divvying it up into 7 of those 50,000. And yeah, it's just a one-time, once the funding is done, it is done. Great question. Okay. So kind of the process and how this will go. Anyone who wants to be considered for the mini grant will have to submit an application to me by 5 p.m. on January 15th. We will then share those applications with the review committee. We have a scoring template that everyone is using. It's the same template, and it's based off those things that we asked for to be in the application. So nothing sneaky. And so they will go through and we'll vote and come together and discuss, and 7 will be chosen. Those 7 will be notified that they have been awarded, and then everyone else will be notified that they have not been awarded. So you'll hear either way. From there, we'll contact you around contracting and next steps. But it all starts with an application. If you are subscribed to our emails on our website, or if you are currently on our contact list, we will send out all of this info to you on January 1st. And so you can put together the budget and the narrative and have everything. And like I said, if you have any questions while you're going through it, you can definitely reach out as well. There are some things, I know we said dream big, what would you do? But there are some things we just cannot spend the money on. And that is capital expenditures. So things like building or land purchase or construction. Advertising except if they're solely for program outreach and specific purposes necessary to meet goals of the project. So if you have questions around this one, just let us know. No alcoholic beverage purchases, entertainment, except where they have a programmatic purpose, fundraising, goods or services for personal use, or any lobbying. But that is it. All right. So we're super excited to be able to offer this. Cannot wait to award those 7 awesome things that are happening. We know there's more than 7 out there, so that is a really big bummer, but we're excited to be able to hopefully move the needle and make a really big difference for 7 agencies in our region, and hopefully a lot of birthing people in our region as well. Any other questions?
I'm just gonna, I guess I just can't, I was starting to type it up, but it was too long. So I'm just gonna say, I guess, so I knew obviously as I was asking everybody, like dream big, dream big, dream big. I love to start there and kind of start to come back down to like what's realistic and feasible in a short turnaround time and one time only. And I can just say, as someone who's coming from a gigantic organization or a bigger one that has a lot of systems in place, obviously, well, I shouldn't say obviously, KRESA would not be a place where I would say like, oh yeah, we'll do this and we'll do that. We're just not nimble enough. But I think many of us have contacts and conversations and connections with organizations that are nimble enough, that are maybe here at this table or elsewhere. And so I just would encourage everybody to think about that. Like, who could we work with that would be able to turn this around and really use this funding to support families, to make a huge difference, but also not something that they have to like create this brand new thing so that it is going to disappear, in 12 months time or less than that. So just, encouraging people to really think outside the box and who you could connect with. Obviously they need to be a nonprofit and they need to exist and all that other stuff, but probably Bronson and KRESA aren't going to like do it because there's too much to jump through, but so many of you work with or are those kinds of organizations. So it still can feel really exciting.
Yeah, that's a really good point, Sarah. Thank you for sharing that. SWMPIC is always shamelessly like, share everything, tell everybody. This is another one of those things where like, share with anybody that you think that this would be something that they could really benefit from. Joel.
So to echo what Sarah was saying, it's so rare to have a grant opportunity that has so few restrictions and so few reporting requirements. So it's really nice to have this as an opportunity. So be bold. Really think about what could you do in this time frame that's innovative, that's creative, that's exciting, and give it a try. So we encourage people to think outside of what we normally do with this grant money.
Yeah, absolutely. I'm so excited to see what you all come up with.
Alina, there's one more question in the chat about where the information will be posted.
Oh, good question. We will definitely put it on the website. It will live there as including the recording to today as well. So that will live on the website and the stuff. And then we'll also send it via email and the newsletter as well.
And it's going out January 1st?
June 1st. Yes.
Yeah.
Yep. But like I said, so when we send out the recap for the quarterly collaborative meetings, that should go up by the end of the week this week, and it will have the slide notes in it. So it will have the slide that says like, these are the things in which we're looking for. So if you wanted to get a head start before January 1st and start putting some things together, you can do that. All right, Elise.
Oh, yep. I can also, I'll make sure that all the information is up on the website, probably by the end of the week or early next week. But then the application or whenever we are going to officially release this, I'll make sure that specific thing is up January 1st.
Awesome. All right. And like I said, if you have any questions as you start to get into this and you want to just check, feel free to send me an email. All right, I'm going to pass the mic over to Dr. Garcia for our birthing hospital check-in.
Thanks so much, everybody. And I apologize, I had to switch to my phone because my computer died. What we're hoping to continue to do is to start helping uplift the work that's being done with our birthing hospitals. So at the moment, we are down by one hospital system because I'm sure all of you guys have heard that Coldwater Hospital System ended up closing down their birthing unit just within the past 2 months. At the moment, we've got the Bronson system between Kalamazoo and Battle Creek. We've got the Corwell Health System, both out in Lakeland, Niles, and the Lakeland area. We've got Oaklawn Hospital in Marshall, we've got Borges in Kalamazoo, and we've got the Beacon Health System in Three Rivers. So what we'd like to invite you guys, if there's anyone here that's representing any of the hospital systems, just give us a quick update insofar as, some of the work that you guys are doing, some of the things that SWMPQIC and the collaborative may be able to help support in the work that you guys are doing, or how it is that MIAIM is going for you guys. Are you guys applying? Are you guys currently doing some work so that way we can help uplift the work that you guys are doing? So I'll try to be a little bit intentional and just kind of call around. I'm going to start with Beacon Health and Three Rivers. Is there anybody that's on that would like to talk about any of the work that you guys are doing?
Yep. My name's Nikki. I am the nurse advocate for Beacon Three Rivers. Right now we are trying to kind of adjust because we only have one office. Because we are seeing a lot of the Coldwater fallout, but we also have LaGrange in Indiana, just over the border, also closed their birthing center. So we are also seeing a lot of their patients coming up. So we are trying to adjust to that influx because we are still such a small facility. We have been doing very well with all the MIAIMs, and we hope to be able to continue to throughout all of the adjustment period with the closures.
Well, thanks so much, Nikki. We really do appreciate you guys working so strongly to make sure that all of these families have a safe place to be able to deliver their families. So thanks so much. All right. And then I am going to invite Borges. Do we have anyone from Ascension Borges on today?
I am. Hi. We over here are we're in our rebuilding phase right now. A lot of stuff has happened in the past year, so we are just trying to build ourselves back up currently. And we're hoping for a good new year next year. We've been really reaching out with the community more and getting some more involvement as to what our patients really want over here.
Awesome. Well, awesome work, Crystal. We really do appreciate you guys being a part. And then, like I said, definitely let us know if there's anything that you guys think that SWMPQIC might be able to help support you guys with. All right. Anyone from Oaklawn on today?
I don't like to represent Oaklawn, but that is the hospital that I'm going to be delivering my baby at. This is Tina. And I don't really know a lot about what they got going on with like helping like the prenatal and stuff like that, or like after birthing and stuff. But I do want to let you guys know in case there's anybody who has Meridian around here that also is or was attending Oaklawn. Oaklawn Hospital will no longer be accepting Meridian insurance. So if you have Meridian, the only place that you can go to in the area is going to be Kalamazoo. So just make sure that you get your insurance switched over before the first of the year.
Thanks so much, Tina, for sharing that information. And yeah, because I think Jill was trying to log on. There.
Yes, and Tina, thank you for that. And it's true that our contract is up with Meridian as of January 1st, but they are still negotiating, so there may be a change there, but they have asked to have people change if they're going to deliver at Oakland Hospital after the first of the year. I was hired as the OB nurse navigator in July. I'm a 30-year veteran of Oakland Hospital labor and delivery, and I am set to have resources and get them to people that are going to deliver at Oakland. So Tina, you could connect with me somehow, ask for the OB nurse navigator at your doctor's appointment, and I will come in and see you. But we have, I have been supported very well through SWMPQIC, and as far as like getting flyers out in doctors' offices for the prenatal classes that are virtual, and the Know Your Risk for the postpartum depression virtual classes that they have. That's been very helpful to me. And also knowing about Milk Like Mine and all the resources that they have for our patients that we serve at in Albion and Marshall. And we're preparing for the Sepsis My Aim bundle pack. And I hopefully will have the signatures that I need. I'm just looking for the doctor to sign for my signature, and I'll have it in by the 29th. Also, in my position, I was able to be in a couple of the SWMPQIC meetings. So I was awarded, or Oakland Hospital was awarded $1,000 grant for that. And we received it, and they're going to give me some of the funds to pass out the Your Pregnancy and Childbirth books to people that I meet that might want them. And we can go through those. As a nurse navigator, I can do that with the patient one-on-one and explain it, and then just try to get them hooked up with the necessary things that they would need during their pregnancy. So.
Well, thanks so much, Jill.
And I'm trying.
And I know that you're connecting with Marshy to try to figure out those nitpicky things about MIAIM, right?
Yes, and I'm trying to share what SWMPQIC is to our doctors too, because they don't all understand, but they all want to, and they all want more resources for their patients. So this is just a great organization to be involved in.
Yeah, absolutely. Let us know. And anytime that you have anybody that needs more information, you can always give me a call. All right. And then do we have anyone on from Corwell? I thought I saw Tina on there earlier.
Yes, I'm on here. So, hi. So the update I can share, not really sure what's going on with in the OB department. I haven't met with Tammy Jers, and I can share this. I'm working, we're looking to bring MIHP program, the home visiting program that was once in Berrien County, excited about. We're looking to stand that program up late 2024, 2025, a home visiting program. And then also we're expanding. We have the Center for Better Health in Benton Harbor, Michigan. And it's providing services, kind of like an extension from some of the services that was offered at our St. Joseph location. I don't know if many of you know, many years ago, the city of Benton Harbor once had a hospital there. And so that hospital is no longer there. It has been gone for many years, but the Center for Better Health was birthed out of COVID. And so now we're going to expand that center, and we're moving into a 24,000 square feet location, and that is going to happen in February of 2024. And we will continue to offer supportive services for residents throughout the community. We will currently, the center is providing services to moms. We're doing like diaper distribution, and we have a cardiologist that is working there at the Center for Better Health, and so looking to expand with more services. And also we have, I think it's 2 community health workers that is operating out of the Center for Better Health. So really, really looking forward to going to this new location, bigger location. Yeah, so I think that's probably all I have to share, but thank you.
Well, thanks so much for sharing all of those amazing updates. All right. And then I'm going to throw it over to the Bronson team. Anything that anyone would like to uplift and give updates on?
Mr. Garcia, it's Carol. I'm going to go ahead and jump in since a couple of folks have sent me texts going, you going to talk or are we going to talk? So I guess I got picked. First, I want to make sure that everyone has heard that we very successfully opened baby cafes in Calhoun County with partnership with Milk Like Mine after receiving a large grant from the Kellogg Foundation. We are looking at a second site to open yet in January with the Burma Center there, and we'll be opening in Kalamazoo County as well with True Rooted partnerships in 2024. We'll be expanding out towards Marshall and Albion as well with future sites in partnership with those areas and doing baby cafes. We've had really good success with our baby cafes and with attendance. We've done them in person, we've done them virtually, we've had dads come in and we do a dads program. It's really been absolutely amazing. We continue with our Michigan AIM work at both facilities and have had very good success in 2023 and expect to continue that in 2024. We do have our peer navigator working with our mothers of substance misuse that will become very much more active in 2024 now that she's completed her training and is back on site with us. We are continuing our baby-friendly journey, as many other hospitals have. We will hopefully be completing the final stages of that in early 2024 as well. And just a couple of quick announcements. We had the same problem that Marshall's having with Meridian. However, Bronson has entered into an agreement with them, and so Meridian will not be a problem at Bronson Battle Creek or Bronson Kalamazoo. So if those services are needed with folks who have Meridian, that will not be a problem with Bronson now, although we anticipated it would be. And then the last thing Tammy wanted me to mention, she's putting a group together in Battle Creek at Bronson Battle Creek to look at natural birth suites. We are partnering with our providers and nursing staff and our community to look at how we might be able to provide an environment within the hospital that provides a much more home type birth experience for those that choose that type of birth. So we are looking at that and investigating that, and we are very hopeful we'll be able to get a couple suites up and running at Bronson Battle Creek in 2024.
There was a question, is Borges still not going to take Meridian? I wasn't sure where Borges stood on that.
Last I heard, we're currently no, we're not, but they are still in negotiations right now.
Okay. Thanks so much, Crystal. All right. Any updates, any other work that anybody wants to throw in? All right, awesome. Well, I'm going to give it back to you, Elise.
All right, thank you for those updates. So we're going to pause here and just ask that everyone completes a quick evaluation. This evaluation lets us know what you enjoyed today and what we can do better. SWMPIC looks at this information after each meeting and we use it to plan for our future meetings, and we appreciate your feedback. So you can complete the evaluation by either using your phone with the QR code or by clicking on the link in the chat. So we'll just pause and give you a minute to do that.
I was gonna play music, but it's not currently letting me.
I mean, Elena, you could always just sing.
I don't think anybody wants that. The other day, my husband and I started singing Twinkle Twinkle Little Star, and my 1.5-year-old walked up to me and went, "No." I was like, okay.
Just out of curiosity, I'm sorry you can hear my washing machine going in the background. Do you guys know why the hospitals are like cutting contracts with Meridian? Like, is there a specific reason? Are they just not, is Meridian like just moving regions and they're not going to be down in this area any longer? Or is it, you know, is there like a specific reason for that? Because I've had Meridian for like a really long time. So when I re-enrolled for insurance, that's who I enrolled with, was Meridian, because I was like, oh, everywhere except Meridian. Like I can go anywhere with them because I'm from Kalamazoo, but we moved Battle Creek and bought a house out here. And then I go to set up my my first ever OB appointment, and I had to call literally Kalamazoo. I had to call Marshall. I had to call Coldwater. I had to call here in Battle Creek, and nowhere they were like, yeah, well, you know, we're not accepting Meridian, or after January 1st, we're probably not going to accept it. And I'm like, well, what do I do? And they're like, you'll have to go all the way to Kalamazoo. And I'm like, I can't go all the way to Kalamazoo. That's like a 40-minute drive, like one way. I can't. That's just, I can't afford gas. My husband has to work. Like I'm a stay-at-home mom. I do homeschooling and stuff. Like I just didn't know if there was like a specific reason as to why they were like stopping like using Meridian, because I mean that's like my favorite insurance, and you know, if there's the ability for me to be able to continue to use what I know and what I'm comfortable with, then I would, you know, like to try to do that, or at least if I can go back to them eventually.
Thanks so much, Tina, for your question. I'm going to see if anyone from our affected hospital systems wanted to speak up on that. Oh, Jill, I see you waving. Oh, you're still muted though.
Yeah. I can speak to that because Meridian was at the Albion Fair, the baby fair advertising. That's when I first heard about it, was in September. So it surprised me as well. Plus a lot of the patients that I connect with have Meridian, and it was very disheartening for them to hear that they would have to switch over. And I'm very sorry about that. But they said there's millions and millions of dollars that they haven't paid over years to the hospitals. So they just can't keep that perpetuating as a need. So they are working on trying to give them a little more grace as far as time and paying the bills that they have outstanding. But so our director of nursing was talking to our OB department and said there are some negotiating. So there was a little more promise that possibly that would not be the case in January, but they're still telling us to tell patients to switch over if they can. So.
I actually met you in September at the baby meeting. I'm pretty sure at the like the there was like a bunch of different tables set up, and there was I don't even remember how many people were there, and there was like raffles for like diapers and like pack plays and that kind of stuff. I think that I met you there, Joe, actually.
Okay, good. Well, hopefully I'll see you today too.
Thanks again, Jill, for being able to speak up on that.
Yes, thank you so much. I appreciate that. And that's whack on Meridian's part, but unfortunately I can't do anything about that.
All right, if we're ready to move on from this evaluation, I'll pass it over to Joel.
All right, there's the unmute. All right, everybody, we really appreciate your time today. We really appreciate you sharing and being part of this meeting today. This is your chance to share any kinds of initiatives, news, or events happening at your agency or in your county. Anything else we haven't talked about yet today that you'd like to share with us?
Hi, this is Keena from Core Oral Health. I had to think about where I'm from, but excited to share There was a lot of work that happened with the ABES project, Achieving Birth Equity Through System Transformation. The work initially started off with the Berrien County Health Department, a group of our community partners that was working and went through a series of workshops, working alongside Michigan Public Health Institute was facilitating those trainings and workshops, and just excited that we're in the final stages of completing a birth ecosystem map with our community partners, and excited that that work has transitioned to Corewell Health. So the work is continuing, and just excited to share that we have a great group of community partners that is really working to improve and support birth equity. And so in the maternal and child health space. So just really excited about the work that has happened with the ABES project. And so just looking forward to expanding that task force. So yeah, shout out to Michigan Public Health Institute. I know Jennifer is on, I think Jennifer is still on here, but yeah, was very vital in that work that happened.
Thanks for the shout out, Kina.
All right, thank you for sharing. Anybody else?
Any events or resources that you would like SWMPIC to share, like flyers and out in our recap email to others?
I would just love to share a little bit about some of the really exciting early literacy efforts that are happening around this whole region. So a lot of us that are on this call also serve on this early literacy hub, which is not a physical place, but it's just kind of similar to this, kind of a collaborative of all of the Southwest region counties who are really focused on early literacy. And that by that we mean like babies, babies. So some of you probably are in counties where talking is teaching is something that you're seeing a lot of. Not everybody is doing talking is teaching, but we're really the state level and then locally, we're really focused on trying to connect around early literacy. So like in Kalamazoo, we're working with pediatricians, and we're working with home visitors in the WIC office and things like that, and even our birth doula. So if you haven't seen any of that yet, kind of keep your eyes peeled and think about what you might want to do. It's definitely geared towards that connection piece too. So really looking at how can our early literacy activities, not just reading books, but like communicating with our little ones and singing songs, build that attachment that we know does impact health outcomes. So just exciting, just fun stuff. And so kind of keep your eyes peeled for some of that too.
My name is Shanita McCleary. Can you hear me? Hi, my name is Shanita McCleary. I am the Quality Improvement Manager here at Meridian. This is my very first time joining this call. I look forward to being a part of these conversations moving forward. I have been messaging my provider relations team about all of the information regarding Meridian, and they did let me know that they are working on addressing the issues with the various hospitals. So it's not a done issue or dead issue with regard to those particular hospitals. So more information to come. Sorry, I can't provide the updates because I am in quality, but I am messaging them like crazy.
Out of curiosity, oh, I'm sorry. I didn't know if somebody else was going to speak.
Go ahead.
I was just going to say, out of curiosity, just because I am, I was a Meridian user. Once the first happens, I'm not going to be a Meridian user anymore. I'll have the clearance. But if, so any appointments that I go to or anything like that, since there's the whole, they weren't paying or whatever the issue was, Is that going to fall back on me, or is that something that my new insurance provider is going to like pick up and take care of for me?
It will not fall on you. And your new, it all goes on eligibility. So while you are enrolled with Meridian, Meridian is responsible for services that pertain to your maternity care. So no hospital system provider, anyone is able to bill you for services while you have active coverage with Meridian. It is something that definitely Meridian will be responsible in all of their negotiation, and they're working with those other entities in those hospitals to come up with the contracting, and then they will be responsible with addressing all of our enrollees' care that we receive, the bills, the claims, all of that. So don't worry about, any bills coming to you per se. And if you do receive a bill, please call Meridian.
Thank you. I appreciate that.
And to address Sarah Drum's literacy announcement, we did have a big bag of newborn books dropped off by the Calhoun County Education Outreach ladies, and they had a big bag that they dropped off for our newborns that they could hold, and parents could start reading to newborns, just so you know that's out there.
Thanks for sharing, Jill. Looks like Sarah put the link in the chat too as well. Any others? Anything you want to share? Joel, you want to close us out?
All right, everybody, thank you so much for your time today. Thank you for giving us your time. Thank you for participating. Thank you for all the great ideas you raised today. We really appreciate it. We love hearing from folks who are so committed to this work and are really excited about 2024 going forward. A great leadership team here at SWMPIC, and we really appreciate everybody engaging. Really appreciate birthing hospitals coming to these meetings and sharing out with us. It's been a big push for us. And thank you to all of our folks who live and work and the community members who are part of this too. We know it's hard to take time out during your day, and thank you very much for being here with us today. Don't forget, if you haven't signed in yet, there's a QR code there to sign in the last minute. But thank you, everybody. Really appreciate you.
Subscribe if you haven't.
Like, share, and subscribe.
Yep. Thanks, everyone.
Thank you guys so much. You guys have yourselves a happy holiday.
Thanks, you too.
Do we need to talk about anything, or am I good?
I think we're good. I'm just
We're good?
trying to, pull over the chat.
Gotcha. Cool.
Thank you.
Happy holidays.
You too. Bye.